Michigan Health Department reverses course, updates to CDC COVID-19 quarantine guidelines. Just 2 days after saying it was not adopting shorter federal COVID-19 isolation and quarantine guidelines, the Michigan Health Department announced that it now plans to update them. The state health department said Friday it is updating its state guidance to reflect the recent recommendations from the Centers for Disease Control and Prevention. Notably, the announcement said, the CDC recommends a shortening of the quarantine and isolation duration for those who aren't vaccinated or haven't received their booster to 5 days, followed by an additional 5 days of wearing a well-fitting mask around others. Earlier this week, the Michigan Department of Health and Human Services said it needed more time to review the supporting evidence before making changes to its guidelines. The Free Press left a message with the health department seeking further comment. Read more. These Metro Detroit NYE events have been canceled. Defense, no way Captain Autism masterminded Whitmer plot. As new virus variants emerge and a multitude of agencies, local, county, state and federal, as well as private employers, offer their own recommendations and requirements, it's easy to see why some Michiganders might be confused and frustrated. Michigan broke a pandemic record Wednesday for new daily cases. State health officials reported a 2-day total of 25,858 confirmed cases, an average of 12,929 per day. Dr. Natasha Bagdasarian, the health department's chief medical executive, said Friday that vaccinations are the best protection against severe illness and hospitalization, and urged all Michiganders who are 5 and older to get vaccinated as soon as possible. Bagdasarian also said the most recent updates to the quarantine and isolation guidelines are a reflection on our progress as we learn more about COVID, but we are not in the clear as variants like Omicron continue to create new challenges. Health officials said state data shows those who are unvaccinated have 4.3 times the risk of testing positive for COVID-19 and 12.2 times the risk of dying from COVID-19 compared to people who are fully vaccinated. Contact Frank Witzel, 313-222-5022 or fwitzel@freepress.com.